My name is Sheila LaCroix. I go to Adventist College. And I was very lucky. I don't know how many of you have done a situs inversus patient. On my first day of clinicals, I had the privilege of doing a situs inversus patient, and I was extremely excited about it. I did. A 44-year-old Hispanic woman came into the emergency department with an abnormal EKG. Her BP was normal, but because of the abnormal EKG and the situs inversus, they went ahead and admitted her and administered a stress rest with Bruce protocol to determine, see if they could determine the abnormal EKG results. Why was that? The appellation situs, what it does, the word situs means the identifying the positioning of the cardiac atria. And situs solitis is normal positioning. The lungs, the bilobe lungs, the trilobe lungs, the heart, liver, stomach, and spleen are all in normal position, situs solitis. Heterotaxy is a spectrum. Right atrial isomerism is where both lungs are trilobed. The heart is in the center, the liver is in the center, and the stomach is in the center. And you'll notice the absence of a spleen. It's called asplenia. There's no spleen. In left atrial isomerism, you have two bilobe lungs, a centralized heart, a centralized liver, a centralized stomach, and polysplenia. You have multiple spleens. And a lot of times you have 10, 20, 30 spleens, all little tiny spleens doing the work of one spleen. And sometimes people don't even know they don't have a spleen because the multiple spleens work in harmony, in concert, to get the job done, somehow, some way. And over here we have situs inversus, where this is situs inversus totalis, where all the organs are transposed. So you have your liver, stomach, spleen, and heart, and your trilobe and bilobe lungs are all reversed. Now sometimes in situs inversus totalis, but not always, even the brain is reversed. So where you would have the, like you were talking about the substantia nigra earlier, reverse, it's on the other side. You have Kudman, it's on the other side. You have everything is transposed, including the areas of the brain that perform different functioning. So you would think you're left-brained, you're really left-brained, you're right-brained. Everything's transposed throughout the body, including your sexual organs. But not all the time, and they don't know why. This is right isomerism. Whoops. How do I get back? Okay. This is right isomerism here. Of an actual patient, you'll notice the complete absence of a spleen. And down here for left isomerism, you'll notice the teeny, small little spleens, all the multi-spleens. And for heterotaxy, what's in the center of your body here is your liver. It's right in the middle. It's not off to the upper right quadrant where it should be. With situs inversus, you have levocardia and dextrocardia, which is the positioning of the apex. So you'll notice here with levocardia, it presents with the descending aorta, which is difficult to see in this picture. The left atrium and the stomach are on the right, and over here it's reversed, and the left atrium and the stomach are on the left. Also presenting with levocardia, you will have what's known as atrioventricular canal defect. And that is where there is a hole in the septum, and it allows the oxygenated and deoxygenated blood to commingle, so that a person never gets completely deoxygenated blood or oxygenated blood where it needs to be in the heart. So they're always tired, always lethargic. One of the things they've recently, in the last 5 years, done to identify people with situs inversus is primary cilia dyskinesia. And that is where the cilia in your body, and I'm going to go back and forth here for a second. This is the cilia in your body. It lines your trachea and your fallopian area. This is healthy cilia, and this is unhealthy cilia. You can see the difference. And what it does,
That's where Disney.
she's very excited. And what it does is they determine that patients with PCD, primary ciliary dyskinesia, 25% of them have situs inversus. However, 50% of those with %25% of those with situs inversus have PCD. However, 50% of those with PCD have situs inversus. The reason is unknown. It also breaks down here the percentage with left isomerism, right isomerism, and the other anomalies that come with it that we didn't get into. Both parents, in order for a child to be born with situs inversus, must be carriers. And if both parents are carriers, there's a 25% chance that they will have an infected son or daughter. It is not distinguished between boys and girls. It is just unilateral. For whatever reason, it's 25% straight down the middle. It's autosomal recessive. When you're positioning a patient with situs inversus, two things have to come into play. Sorry, one minute.
No, put it on.
When you're positioning your patient with situs inversus, their head should be placed in this, the body should be placed in the supine position, head first into the camera, with the camera at the normal starting angle. Or you can position them in the normal positioning, which is feet first, and you reverse the camera at negative 45 degrees. One of the key attributes you must do when imaging a patient with situs inversus is reverse the leads. If you don't reverse the leads on a patient with situs inversus, your STRQ waves are all going to come out upside down. Like this. This is a chart from a patient with situs inversus, and the P waves are reversed, QRS report as negative, and the T waves are manifested as inferior leads. It incorrectly identifies the person as having an anterior infarction. One of the greatest challenges with a patient with situs inversus is transplants. For some reason, the majority of those who have novocardia will have to have a lung transplant and a heart transplant at some time during their life. This is the position, this is a normal heart, and you have to get this to fit this. You have to get, you have to get this mount position in this section here. So you've got to take all these conduits and reverse them in a transplant with a surgeon. I've been lucky enough to do a couple surgeries, but I've not done a situs inversus surgery, a heart transplant surgery. One of the gentlemen that I work with, Dr. Boyer, in doing one, he says that they take the arch here and utilize it and chop it into pieces to use to anastomose with the other veins, arteries, and stuff to make them longer, to make them shorter, whatever they need to do to make it fit in the heart. The patient I worked with was a 44-year-old Hispanic woman. Her ejection factor ended up being 84%, which is well above normal. Her TID was 0.8. She had no acute ST or T waves. Her gated wall was normal, left ventricle, and no anomalies. So what was advised with her was to release her and keep her for monitoring every 6 months with the cardiologist to see if they could determine what the abnormal EKG was and identify it during the testing. And I have a lot of references because there is not a lot about situs inversus. It's very rare, and it is 0.01% of the population has it, and as it digresses into levocardia or dextrocardia, it gets more and more rare. So the chances you'll see it is very slim to none. One of the techs I work with, who's been doing it for 13 years, this was his second patient, and one of the techs I work with who's been doing it for 10 years, this was his first, and I happened to have it on my first day. It was very exciting. So, has anybody seen one? You did?
We have
Put them in head first.
Okay.
We flip the patient around, put them in, feet first, and then just move our camera down and adjust it accordingly.
Or prone.
We were just caught off guard because we were looking at the page screen saying, that doesn't look right.
Did they know
What's going on
they
here?
were
We had no.
Or did the patient know?
No.
So
We
they
had no
didn't know?
idea with the patient coming in, it was an outpatient, we didn't have a whole lot of information, it was like, oh, whoa, that's a funky looking heart, boy, there's a little.
In my first week, I had this on my first day, and then on my third day, I was lucky enough to have a patient with 3 kidneys. So it was like really cool.
Unique.
It was a cool week. That was a really cool week. A week of anomalies.